Welcome to this training module on the topic of our rigid multifocal lens, the Expert Progressive. In this training, we will discuss some generalities about presbyopia. We will then discuss the different vision systems used in contact lenses in the context of presbyopia. Finally, we will introduce you to the Expert Progressive, its particularities, and its fitting. First, let's look at what presbyopia is. Presbyopia is characterized by a loss of elasticity of the crystalline, leading to a loss of accommodation. This loss of accommodation causes a decrease in the depth of field of vision, leading to a decrease in the quality of near vision. It is possible to restore this near vision, either with the help of positive power optical equipment or by recreating a depth of field. Now let's see what vision systems are available in contact lenses. Simultaneous vision is a method applied to all soft multifocal lenses, as well as to a majority of rigid multifocal lenses. This method allows correct vision in all directions and at any distance, thanks to an arrangement of visual areas in concentric circles. It can be central distance vision, to promote the quality of distance vision, or central near vision, to promote near vision. Nevertheless, it has several disadvantages such as decreased contrast sensitivity, decreased visual acuity, halos around light sources, disturbed night vision. It is very dependent on the size of the pupil. Alternating vision is a method applied only to certain rigid multifocal lenses. This method uses the translation of the lens according to the orientation of the eye lines, so that distance vision is clear in distance vision in primary gaze and near vision is clear in downward view. The most effective alternating vision is segmented alternating vision, which allows for uncompromised quality of vision at any distance, comparable to the quality of vision with progressive spectacles. It also allows independence of pupil size. This is the method used for the Expert Progressive. Now let's take a look at how to fit and control the Expert Progressive lens. As previously stated, the Expert Progressive is a rigid multifocal lens with segmented alternating vision. The arrangement of the vision ranges is similar to that of progressive spectacles, with distance vision in the upper part, then the intermediate vision, and finally, the near vision. This arrangement allows for a natural and uncompromising quality of vision. The anterior profile is sphero-aspheric. It has a prism in order to ensure a stabilization of the lens is a good orientation of the visual ranges, and a slab-off, which allows to obtain a more ergonomic lower edge in order to obtain a more natural and comfortable support on the lower eyelid. The posterior profile is quadricurves in most cases, but it is also available in sphero-aspheric with a single diameter of 9.80. The edge lifts are customizable, as well as the height of the viewing ranges. The calculation of first intention lenses is carried out using click and fit. It is necessary to mention the refraction in distance vision, as well as the addition worn in spectacles. Keratometry and corneal diameter are also essential. It is strongly recommended to mention the eyelid biometrics, with the measurement of the eyelid opening, overlaps, and eyelid tone, so that the first intention parameters are as accurate as possible. In order to ensure optimal results with the Expert Progressive, the eyelid opening must be at least 9 mm, and the lower eyelid must be tangent to the limbus. A covering or uncovering of 0.5 mm is tolerated. The fitting is optimal when visual acuity is satisfying. Centering is expected at the bottom, resting on the lower eyelid. The movement at the blink must be of low amplitude with a rapid recentering in order to avoid fluctuating vision with each blink. When looking downwards, there should be an upward translation of the lens. The optimal fluorescent image, when the lens is centered on the cornea, shows a slightly tight center, a dark intermediate area, and wide edge lifts. When the lens is in the primary position, we observe a slight lake of fluorescent at the bottom. The visual check in HG is first done by measuring the monocular visual acuity in distance vision, then the binocular. Then you can check the near vision visual acuity, monocular, and then binocular in normal lighting conditions. It is also advisable to test intermediate vision under the usual conditions of use. Whatever the visual acuity, over-refraction must be systematically checked to ensure optimal visual comfort for the patient. During the slit lamp check in white light, the Expert Progressive must be slightly off-center at the bottom and be resting on the lower eyelid. The alignment points should be more or less horizontal, with a rotation tolerance of 20 degrees, and located at the level of the lower third of the pupil. As mentioned above, in the primary gaze position, the movement must be rapid and of low range of blinking. When looking downwards, there must be a translation of the lens upwards, with the upper edge of the lens brushing the limbus. A slight crossing is accepted. The control of the fluorescent image with the slit lamp is achieved using cobalt blue light and a yellow filter. The optimal image shows a slightly tight center, a dark intermediate area, and wide edge lifts. The Click and Fit fitting software offers a follow-up tool allowing you to fill in all the information collected during the checkup in order to suggest any changes to be made if the first intention lenses are not completely satisfying. In order to properly analyze the lenses, if optimization is considered, they must be worn for at least 4 hours. Over-refraction should be performed using trial spectacles. For over-refraction to be usable, you need to make sure that the alignment points are positioned correctly. Now here is the decision tree of the Expert Progressive's optimization for discomfort in distance vision. If the alignment points are positioned in the upper 2/3 of the pupil and the lens is off-center at the top, it is advisable to reduce the diameter in order to reduce the influence of the upper eyelid. On the other hand, if the lens rests on the lower eyelid and a reduction in diameter is not possible, the vision ranges should be lowered. For this modification, please contact Technical Assistance Team. If the alignment points are positioned below the pupil and the lens slides under the lower eyelid, it is advisable to increase the diameter and/or flatten the R0. On the other hand, if the lens rests on the lower eyelid, the diameter should be increased. If the mobility is too important and the lens is already slightly tightened, it is advisable to decrease the diameter and/or increase the prism value by 0.5. Finally, if the alignment points are correctly positioned, the over-refraction must be checked. Here is the decision tree of optimization in case of discomfort in intermediate vision and/or near vision. If the translation in the lower view is good and the alignment points are correctly positioned, the over-refraction must be checked. On the other hand, if the alignment points are located under the pupil and the lower eyelid shows an uncovering, it is advisable to increase the diameter. If the lower eyelid is tangent to the limbus, the diameter and/or the range of near vision should be increased. For this modification, please contact Technical Assistance Team. If the translation is poor and the eyelid tone is weak, the diameter should be increased. On the other hand, if the eyelid tone is strong, the diameter should be reduced. In short, the Expert Progressive lens offers excellent quality of distance, intermediate and near vision. This visual quality is possible thanks to the independence of pupil size, preservation of contrast vision, and no side effects. Wearing comfort is ensured thanks to the slab-off, providing a natural support on the lower eyelid. Feeding is made easy thanks to a simple and efficient calculation using the Click and Fit software. In addition to the Click and Fit software, documentation is available on the PRECILENS.com website. As a reminder, a contact lens fitting must meet visual requirements and respect ocular physiology. A fluorescent image is always made with a lens centered on the cornea, with blue light and a yellow filter. Patients should be systematically reminded of the conditions for compliance of the lenses so that they can be worn safely. And finally, keep in mind that fluency comes from practicing. We hope that this training module has met your expectations, and we thank you for taking it.